Welcome to another episode of Stories from the Edge of Life. Today we have another very special guest from India, Dr. Piyush Gupta. Um, and welcome, sir.
Hi.
Would you mind introducing yourself to our audience, please?
Yeah, I am Dr. Piyush Gupta, and basically, I am heading Cancer Aid Society as Secretary and Principal Executive Officer. I am Secretary of this organization since 1987, and hardly I was 22 when I founded this organization along with other doctors. So, in last 35 years, we have started from a local organization. In 20 in 2000, basically, I had met with several accidents, and that pushed me to join this organization on a full-time basis. And since 2000, this organization grew very fast into a regional and national organization within the next 5 years. And today we are having our offices all across the country. Our head office is at Lucknow. We are having our regional offices in Delhi, Mumbai, Chennai, Kolkata, Ahmedabad, Hyderabad, and Bangalore. And we are working pan-India on prevention and control of cancer, tobacco control, as well as palliative care.
Thank you. And I'm Dr. Parag Bhardwaj. I'm a hospice and palliative medicine physician in the US. So it sounds like the organization that you joined has grown exponentially. Could you tell us the name of the organization? And of course, you already mentioned the scope of what it's trying to do.
Yeah. So basically, Cancer Aid Society started in India in 1987, as Dr. Bharadwaj has said. And in 2018, we got our subsidiary registered at USA also, Cancer Aid Society Incorporation in USA, which is working over there, but we are yet to propagate across the country in USA. Apart from that, we established during COVID menace in 2020, I formed National Association of Palliative Care for Ayush and Integrative Medicine because all the offline courses in palliative care stopped at us immediately because of the COVID pandemic. And there at that particular time, we needed plenty of palliative care professionals because of the psychosocial disturbances due to extended lockdowns. So we formed this National Association of Palliative Care for Ayush and Integrative Medicine. And we launched distance learning courses starting from 3-month certificate course. Slowly, we extended this to 6 months fellowship course. And now we are having 1-year master course in palliative care. All these are distance learning courses with graded and structured curriculum. So these courses are upgradable. Any student who joins a 3-month course, if he finds the curriculum good enough, interesting, he can upgrade to the 6-month course. And 6 months, after doing 6 months, they can upgrade up to 12 months course, that is 1-year course. And we are having, in last 3 years, we are having almost 270 plus students doing various courses. And these involve doctors of all streams, including modern medicine, nurses, volunteers, and all.
Great. So it seems like you're tackling, you've cast a very wide net in terms of what you do. And one thing that caught my ear was you mentioned cancer prevention.
Yeah.
And you mentioned palliative care. So usually, palliative care, the typical framework of palliative care, people think it's mostly end of life. And here you have an organization that is focusing on palliative care and cancer prevention. So quite unique in terms of, just the optics of it. Can you share with us as to how you were able to sell the idea that you're part of an organization where Not only will you take care of patients who need palliative care, but also you're going to move so much upstream that you're actually going to talk about preventing it in the first place.
Yeah. So basically, our model is a very unique model. In 1987, we started our journey educating the school children because they are going to be the future citizens of the country. And to make them healthy, it was very important to catch them early because that is the time when they are developing habits, teach them about healthy diet, healthy lifestyle, so that when they grow up, they'll take care of themselves and that they will also take care of their children. Along with that, while they are children, they'll educate their family members because they are not having any knowledge about early symptoms of cancer or healthy lifestyle. So they become our messengers, volunteers, and they propagate this message within their family, and not only family, but within their community. And that is how we have been working exponentially across the country. So we mobilize almost 7 lakhs to 10 lakhs volunteers every year, and they are covering almost 2 crore people annually. So that is the magnitude of our awareness programs when we are talking about cancer prevention.
Very impressive.
When we are talking about palliative care, basically in 2005, American Cancer Society, they initiated a cancer control leaders development program in India. So I was one of them, and there were around 50 participants. Subsequently, this program was held in Chennai. Then subsequently, in 2006, there was World Cancer Congress in Washington, D.C. And it was, along with that, there was World Conference on Tobacco or Health. And I was one of the selected few to represent the country at Washington, D.C. And they groomed up cancer leaders across the globe in a 15-day session over there. So I was also fortunately there. And we attended the World Cancer Congress and one conference on tobacco or health, and it was sponsored by American Cancer Society. Further, in 2007, they again came back to India, organized a training. Now, on various specialities. So I was selected as one of the members in the palliative care group against my wishes because cancer prevention was something which was to my heart and we were doing since 1987. No issues. Dr. Rajgopal, he was one of my faculties and he received this award of Indian highest award from India. So he was one of my mentors. And in 2007, after learning about palliative care, I jumped into it. Immediately after coming from Delhi, I organized the workshop on palliative care at Sanjay Gandhi Postgraduate Institute of Medical Sciences. And then subsequently, I was given a grant, seed grant from American Cancer Society. And under this grant, we organized workshops in all the regional medical colleges of UP. This grant was extended for the next year to organize workshops in surrounding states. And that was a journey which we started. And till date, we have organized almost 35 workshops on palliative care, grooming the doctors into palliative care across the country.
Very impressive work. Let me ask you, so you got exposed to palliative care around 2007 is what I'm hearing. Is that right?
Yeah.
But you've been working with this organization since 1987. And you mentioned you were 22 years old then.
Yes.
What got you interested in cancer and cancer care at that very young age?
So that is a nice question because when I was in my teens, I could see one lady, one of my aunts, and coming from she was basically a distant aunt, Madam Shama, and she was coming from a rural area, Kesriganj, to Lucknow for the treatment of breast cancer. And there was hardly one doctor, Dr. N.C. Mishra, who was treating cancer at that time. in entire Europe. She used to come to my place, go to the doctor, and whatever medicines were prescribed, they used to come from Switzerland. And these, naturally, they came to my residence and they used to come and collect the medicine. So that was the turning point that I thought that something needs to be done for this disease. If the patient, if we don't have medicines over here, we don't have doctors over here, and all the patients cannot afford to get medicines from Switzerland or other foreign countries. And that was the motivational factor. And as I did my graduation in science, BSc Science, I formed this organization along with other doctors of the city, and that was our starting.
Very impressive. So, you mentioned, in 1987, there was one doctor to treat breast cancer in the city, and the patient had to come all the way from her home, which is in the rural area, all the way to the city to access medications which were coming from abroad. So that was in 1987. How are things now?
No, it was before 87, basically, because when I was in my teens. Yeah.
And how are things now in contrast?
Now we have several super specialty institutes and maybe hundreds of doctors working in the same arena. We have SGPGIMS, we have King George's Medical University, we have Ram Manohar Lohia Institute of Medical Sciences, and we have a dedicated cancer institute. So 4 super specialty institutes owned by the government are there in Lucknow itself. And apart from that, we have several private hospitals in the city. So you can understand the things have changed drastically.
Very happy to hear that. And so where does that bring in palliative care within that picture?
Yeah. So now, basically, when we are talking about infrastructure development, one thing is still lagging across the globe. That is early detection of the patients. We do not get the patients in early stages. Almost 70 to 80% patients are reaching the doctors in advanced stages when the cancer is probably incurable, and that leads to the need for palliative care, because at that time, if we are giving curative treatment, now, we are not going to get a better prognosis. However, the financial status of the patient, it goes below poverty line, and the entire family goes on the verge of financial breakdown. So that is something which should be avoided by early detection, promoting early detection of cancer. And in case if we are getting patients in advanced stages, they should be referred to palliative care professionals, which is not being done right now. However, with our palliative care workshops in institutions like Sanjay Gandhi, now they have a pain and palliative care center. Even King George's Medical University, now they have a pain and palliative care center. Even Ram Manohar Lohia Hospital, Institute of Medical Sciences, they are also having pain clinics. So we are trying to push the hospitals into developing pain clinics. And for your information, this year I have got lead grant from International Association of Hospice and Palliative Care, so as to promote nationwide advocacy on palliative care across the country. So I'm working on it this year, and probably we'll try to handle the issue. Again, one important thing, in 2015, this Narcotic Drugs and Psychotropic Substances Act was amended. And this amendment started in 2012. At that time, I was also one of the members of the committee, along with Dr. Rajgopal, Dr. Sushma Bhatnagar, etc. And we gave our inputs, which were incorporated, and finally the act was amended in 2015. However, after the amendment of Narcotic Drugs and Psychotropic Substances Act, still availability of oral morphine is not up to mark, for a simple reason that the state governments still need sensitization. The central government acted, they did a very wonderful job, but the state governments, again, they are following the old rules and they are yet to follow the new rules. which have already simplified the availability of oral morphine along with other essential narcotic drugs. So I'll be working on the issue and trying to get it solved.
Great. Could you explain to us what exactly was the amendment that was made? I mean, in terms of practically,
Yeah.
what did that mean for the population?
Okay. So before this amendment, what happened that this uh, licensing of oral morphine and other essential narcotic drugs, now it was done by excise department. And excise department is something which is managing alcohol, tobacco, and all these things. So getting a license from that department, it becomes very difficult because they see people with apprehension, those who apply for the license of oral morphine. And there were several licenses. That means a possession license, a transport license. If the medicine is coming from outside the state, then they needed permit for transportation. So while a person got one license, the other expired because these were very maybe a few months licenses. We advocated on the issue, and central government they took up the issues by the federal government, and they formed a uniform licensing procedure because many states they were having excise department which was issuing the license. In some states, drug controller was issuing the license. In some states, both were involved in issuing the license. So there was no maybe single approach for issuing the license. So after the amendment, the central government took away the issues, and they simplified the issue that drug controller would issue the license in all the states, and anyone applying for the license, the drug controller has to issue the license or give explanation why the license has not been issued. So things have been simplified, but state governments they still have to follow the simplified rules, and in many states that has not been done.
Thank you for explaining that for our audience. I was listening to you, and it's just amazing to me how you are doing so much. But it all started with one experience you had as a child. When you saw a family member going through this experience, and look what a difference you're making for so many more people today. Um, just curious to know, you mentioned tobacco, you mentioned breast cancer. So within your experience, what kind of cancers do you see in your organizations? Which is the most prevalent one, and what is your organization doing to tackle that early on?
So basically, when we are talking about the females, it is the breast cancer and the cervix cancer, which is very common. And in case of males, when we are talking, it is the oral cancer, which is very common. And all these three cancers can be early detected, and we can get a quick cure for them. However, for years and years, patients do not go to the doctor, and that lands them into advanced stages. So we are propagating awareness about early signs and symptoms through the students because most of these housewives, they do not get access to the information on cancer and other aspects, that is early detection of cancer, early symptoms of cancer, what they should do if they are having any of these symptoms. So we have designed literatures in 12 Indian languages, and we give these literatures to the students through schools because in a educational institution you get almost 1,000, 2,000, 5,000 students. So you are covering that many families, and when these students become your ambassador, they act as volunteers, they educate their family, then they educate the community, surrounding community, the neighbors, etc. And that is how we are building up the network on awareness. And we recognize the services of such volunteers through certificates, medals, badges, etc. And they help us in mobilizing the resources also. So that is how this program becomes a self-sustainable program. And we've been able to grow in the last 35 years.
Amazing success story. talking about you in particular, so you are a person with many backgrounds. Uh, you're you have experience in the clinical realm, leadership. You've also trained as a lawyer. So I think you're very uniquely positioned to do things that you're describing. Can you just share with us a little bit about, the different facets of who you are?
Yeah. So basically, as you have pointed out, I was a science graduate. Then I did my postgraduate diploma in industrial relations and personal management. I did my LLB, that is law, and then I did PhD. I also did MA in sociology, and I got fellowship from National Cancer Institute USA on the J1 visa. So I did the cancer prevention fellowship. I did my fellowship in palliative care, which was a 6-month fellowship from IPM. So basically, all these degrees, they help me in giving, maybe handling the various areas and work into diversified fields. And that helps me in managing NGOs. And that is how I am leading 2 NGOs in the India, which are a national level organization, and both have a quick and fast success story.
Thank you. And just for our audience, NGO is a non-government organization, right?
Yeah,
And
we are a non-government organization. And for your information, Cancer Aid Society is having a special consultative status with United Nations Economic and Social Council. And we are also working in association with Department of Global Communications of United Nations. And I have represented the country in UN high-level meetings on prevention and control of non-communicable diseases. So we are also a participant of World Health Organization under Global Coordination Mechanism for Non-Communicable Diseases. So that has given us exposure not only across the country, but internationally.
thank you. And non-government organization is like a non-profit, that we typically talk about. Excuse me. So I'm just wondering, what degree are you working on now or next?
Can you just, can you repeat the question?
I was asking, what degree are you working on now or next?
Actually, I got an offer for doing PhD from Lancaster University, USA. But again, now it is not the time to go for self-studies. It is time to give to the community whatever I have gained till now. So maybe it should be the time to give it back to the society, whatever I have gained from them.
Very nice. So with that, we will conclude our interview. Thank you very much for a very insightful description of your experience and all that you've achieved through your organizations. Very inspiring indeed. And I hope that we'll have you back again in the future.
Sure.
Thank
That
you
would
very
be my
much.
pleasure.
Thank you.
Have a nice day. Bye-bye.